Decimal stripping endothelial keratoplasty or DSEK replaces diseased corneal endothelial tissue with a thin donor graft of posterior corneal stroma, Descemet's membrane, and endothelium. The graft tissue can be prepared either manually or automatically using a microkeratome. The use of an automated microkeratome facilitates donor preparation, however, it will add to the cost of surgery. In this video, I will show you a technique of donor lenticle preparation for manual DSEK.
Mounting of the donor corneoscleral rim was done on a barrel artificial chamber with the use of cohesive viscoelastic to protect the endothelium prior to mounting. At least a 2 mm of scleral rim is necessary for a nice watertight fit. The epithelium was then removed. A diamond micrometer knife was set to a cut depth of 400 microns. A 400 microns partial thickness limbal groove at 6 to 7 mm created using the diamond knife, and a lamellar pocket initiated using a crescent knife. A Deaver-Steri straight dissector was used for initial dissection until the corneal apex. Use the sharp edge of the tip during dissection. Then, a Deaver-Steri curved dissector was used for lamellar dissection beyond the corneal apex. Then, the lamellar dissection was done up to the periphery in all directions. The incision site was marked to avoid being included in the donor punching. The Fogla marking technique of cutting of the anterior cap at the edge and reflected, with F marking on the stromal bed and the anterior cap reflected back into position. It is important to release the adhesions between the donor tissue and the artificial chamber cap to avoid caving in of cornea due to negative pressure. Then, the 8 mm punching of the donor graft was done. Use of a cohesive viscoelastic to protect the donor endothelium. The 8 mm donor disc was positioned on the Macaluso inserter with the endothelial side facing up. The donor disc positioned in the marked area on the inserter. Then, it is pulled into the inserter using fine microforceps. The plunger was pushed forward to seal the chamber. A curved microforceps was used to pull in the donor disc and an AC maintainer on slow flow to maintain the chamber, pulling the disc gently and it unfolds automatically. Injection of mid-sized air under the graft was done with the donor graft positioning. The wound was then secured, followed by a complete airfill. Lastly, checking the correct orientation of the F mark. This is a day 1, day 2, and day 5 post-op photos. The manual DSEK donor preparation with the use of lamellar dissectors is feasible. There's no need for a microkeratome unit, head, and artificial chamber. It is a low-cost, accessible alternative in resource-limited settings. Thank you very much for watching.